Hami, there is a question from you. What is the historical trial? I think it was clearly explained, but it is a question. I do not know. Do you want to, in brief, explain about this question?
Yes, I talked about some trials that they don't have contemporary controls. They have historical controls. And this means that, for example, you are doing a routine, for example, and you are prescribing some certain drugs to the patients. Then you discontinue that and you start to prescribe some other medications or some other drugs. Then your controls are not treated at the same time as your, for example, intervention group. This can be called historical trial. Okay, and as we can see in the hierarchy of evidence, the historical trial or the trials with historical or non-contemporary controls, their level of evidence is somehow lower than a classical randomized control trial.
May I have my question?
Okay.
From you.
Sure.
I didn't understand properly the quasi-experimental studies, the quasi, during the classification of the study during the,
Yes, you know that quasi means semi, so not complete experimental. The difference could be in two aspects. One is the randomization, and the other is in having or not having control group. So if you do not have control group, your study is quasi-experimental. If you don't have randomization in your study, I mean random allocation. So the situation is like that. You cannot have random allocation. You cannot call it a true experimental or controlled clinical randomized controlled trial. So the difference comes from these two aspects: randomization and having control group.
So a question appeared in my mind: when there is no control group, when there is no randomization allocation, is this type of a studies reliable to design?
In its we could see its position in the hierarchy of evidence. We will now review it because I want to say also another point about the hierarchy of evidence. Certainly, because of these problems, it is not as valid as a classical randomized controlled trials.
So
but we know that in reality, it's difficult sometimes, and it's sometimes expensive to do a classic randomized controlled trials. And the ethical issue also important, sometimes because of the ethical issue. And because of this ethical issue, for your control group, you should have the best available treatment. So your control group should receive the best available treatment, and the intervention group receive the new drug or technique or so on.
According to the explanation of Professor Shamshuri, one of the items for critically appraising research study, one of the items was, I think it was having a control group or randomizations. So by this way, this type of a study can be considered for critical appraisal?
Yes, sure. The next presentation, in the next presentation, I will talk about the critical appraisal of randomized of clinical trials, and we will have something about this.
Okay. Thank you. I appreciate it. Thank you.
So you're welcome. Just coming back to the hierarchy of evidence, I just want to say one.
Professor Khamis, sorry, there are two other questions. Do you want to present your, or you do want to answer the question? Which one do you like?
Maybe we can see the questions first.
So if you want, can you see them?
Okay. What is the question?
Let me. Okay. And one of the questions was that an example of critical appraising in vitro studies. Dr. Shamshiri has been written. Sorry, it is the answer of the question that given like an example of the standard items for critical appraising of vitro study. That's the name is IVCAT. The other one, another question is CEBM scale is good to follow as a beginner in the research. Of course, it is a question from Professor Shamshiri. Professor Shamshiri, are you available?
Yes.
Would you please answer this question?
Okay, do you hear me?
Yeah.
Yes.
Good. CEBM is an institute which is focused on evidence-based practice. It's a valid and known center, and I think the scale mentioned here is the level of evidence provided by this organization, which is used in some guidelines. For example, when guideline provide the question and the answer, which we name the answer in the guideline as recommendation, after each recommendation, the level of evidence provided, for example, by A, B, C, E, which is get from CEBM level of evidence. So it's a good source for information about evidence-based practice.
Okay, so CBM scale is it's good for clinical practice for the basic appraisal, not high level.
Yeah. Yeah, to find
So
the
for the,
high-level recommendations. Yeah.
okay, thank you. Okay, Professor, apparently there is no other question. If Professor Khani, you wanted to present some other slide, please.
Yes. Okay. Thank you. Just going back to the previous set of slide to tell something about the hierarchy of evidence that we have here. It's now, I think, useful to, again, have a look at this evidence hierarchy. Now we know something about case control studies and cohort studies, and now we can understand that why cohort study is in a higher level of case control study regarding the validity of the evidences. And the point that I want to say that each systematic review of any kinds of these studies is placed one level above the study itself. For example, if there is a systematic review of case-controlled studies in a specific subject, so its place is one level above case-controlled studies, but for example, below a cohort study. Or if you have found a systematic review, including cohort studies, so the level of evidence is just one level above the cohort studies and below the randomized controlled trial. This was the point that I wanted to emphasize and mention. Okay, and then we can now go to the next presentation, which is about critical appraisal of randomized controlled trials. With the basics of the appraisal that Dr. Shamshiri nicely presented, now it's, I think, much easier to focus on randomized controlled trials. Before that, I just want to present some criteria for critical appraisal, but from the perspective of our questions, our PICO questions. You certainly remember from our second session that we had 4 types of questions. One category of our questions was those about diagnostic tests. So when we have a PICO question regarding a specific diagnostic test, and we want to apprise some of the literature that we have found, we can use these criteria in this checklist. Was the test compared blindly and independently with the gold standard? We know that for the diagnostic test study, we do need a gold standard, and the results of our test, the test in question, should be compared with the results of a gold standard. So the second question is, was the test evaluated in a range of patients representative of a clinical practice setting? It seems crucial that the patients who are receiving the test are similar in regarding the range with that with a sample that can represent a real clinical practice setting, not just selected or patients or those with some specific conditions which may have some effects on the results of the test. The third item is, did everyone who received the new test get the gold standard as well? This seems clear that why this checklist, why this item should be checked when we think about the aim of the study. Then, can the test be replicated in my practice? This is the question that we should ask when we reading any article, when we want to use the results for our clinical practice. Then, do the results of the test apply to my patient? Again, we are concerned about if these results are useful for my clinical routine practice or not. Then, regarding the articles about causation, when we know that, for example, the cohort studies are the type of studies that are usually used for these causation questions. So, and I think these items are the same as, many of them are the same as Professor Shamshiri presented when regarding critical appraisal of cohort studies, that were the comparison groups similar, were the exposures and the outcome measured in the same way in both groups, did the exposure precede the outcome, is there dose response relationship, does the association make sense, or can I apply the results to my practice? So I go to the next slide, and this is assessing article about prognosis. When we have some question about the prognosis of a condition or a treatment, then where the patients will describe the representative and at a similar point in development of their disease, was follow-up sufficiently long and complete? Again, the same as what Professor Shamshiri said and presented. Were the outcome criteria explicit and applied objectively, and were extraneous prognostic factors adjusted for? And were the study patients similar to my own, will the results help to select or avoid therapy or provide advice for patients? You can see we have the same question in all of the checklists because the ultimate goal in evidence-based practice is to find some answer to our clinical questions. And then when we come to the papers about therapy, the most useful studies are randomized controlled trials. So you can see the checklist, a brief checklist for assessing and for critically appraising randomized controlled trials. The first and the most important item is that was the allocation of patients to study groups random or not. We talked about randomization and how much it is important. So the first item refers to the random allocation of patients to study groups, and we know that if a RCT fails to accomplish this condition, then the validity would be very low. Were all the patients who entered the trial accounted for and analyzed at the end of the study? This is another important point. Regarding the randomization, I want to add that in addition to reporting that we have randomly allocated the patients to the groups, so the authors should mention that they have randomly allocated patients to the study groups. In addition to that, they should state the method of their randomization and random allocation. They should tell about their method. Okay, and then the second one, regarding the dropout, is there any dropout or all the patients who entered the trial accounted for and analyzed at the end of the study? Because if we have dropout, then this dropout may be the results of our intervention. So it is not acceptable. Up to 20% dropout can be accepted if it is justified. But more than that, okay, then we will have some problems with the validity of the paper and the study. Just maybe otherwise it should be justified very good. And there are certain justifications for that. The third item is about blinding, where patients, clinicians, and study personnel blinded or not. We should notice that in some of the clinical trials, it is not possible to do blinding, and we cannot expect, for example, the clinician would be blinded, especially when we are, for example, doing a clinical trial regarding 2 technical procedures. So the clinician cannot be blinded because he or she knows that which procedure is being done. So we should have some realistic expectation here. But if it is possible to do blinding, then it can add to the validity of the results. And then were the groups similar at the outset and treated equally throughout the study? So in clinical trials, we try to behave similarly and in the same manner with the 2 groups, but just the intervention would be different. So we should notice when we are reading an RCT paper, we should notice if there is any difference between the 2 groups, how they have been treated, how they have been behaved. This is one of the items. And then were clinically important outcomes assessed? Again, clinically important outcomes. So I think Dr. Shamshiri clearly explained about these clinically important outcomes. Some of the outcomes are outcomes, but they are not clinically important. For example, when you are reading an article about lesions, for example, periapical lesions, maybe the size of the lesion, the size of the periapical lesion can be considered as a clinically relevant and important outcomes. But for example, presence of some specific cells in the histological sections, they are outcomes, but might not, because we don't know if there is any direct relationship between the presence of these cells in the section and clinical outcomes like pain, swallowing, or something like that. So we should think about clinically important outcomes. And the point is that we have defined these outcomes in our PICO questions. And in that stage, we told that you should, in that stage, you should choose and select clinically important outcomes. And again, the maybe repetitive item in all checklists, that can the results of the study be applied to my patients? This is something that we should judge and we should evaluate, and according to that decide whether or not we can use the results of this study in our clinical practice. Dr. Shamshiri explained about these standardized reporting guidelines, and one of the famous standardized reporting guidelines is the one who is related to clinical trials. You have certainly heard about that, which is CONSORT guideline. So there is a website for that, and you can go there. I have it here, so I try to share the web page, and then we can just have a look at it, and then we will go to a checklist, another checklist, to evaluate and appraise critical RCTs, randomized controlled trials. So just let me to share that page. Okay, I should stop share here. Again, screen share, and just go to here maybe, and then yes. Okay, this is consort web page. If you go to the consort statement, if you want to see the home page of this, I can just. Can you see now the web page?
Yes, doctor, we can see.
Okay, thank you. So this is the homepage of this consort, and there are some tabs here. You can go and download the checklist and its extensions, because there is a core checklist and then there are some extensions. So I want to go to the checklist. And if I open it, it's a Word checklist, but we can also have it here. So it is the 25 item checklist. Okay, this is. Can you see it now? Can you see the checklist in the Word?
Yes,
software?
Dr. Khami. Yes, Professor Khami. It can be observed.
Yes, you can see it. Okay,
Yeah.
No,
this is the
cannot
consort.
see the board
You
file.
cannot see it. Okay.
Yes, we just see the browser.
Okay, you see the browser. Okay, I now try to stop sharing this and again come to here, and oh, where is the checklist now? Yes, no, this one. I think this is the checklist. Now you can see it. Yes.
Yes.
Like the checklist.
Yes, the table is observed.
Yes, like the yes. Like the checklist that we had for example, cohort studies, observational studies, here we have, for example, in the title and the abstract. So the first question is identification as a randomized trial in the title. So in the title, it should be stated that this is a randomized trial. And then regarding the abstract, the structured summary of trial design, methods, results, and conclusions should be stated. Then when we come to introduction, and we are talking about background and objective, scientific background and explanation of rationale and specific objectives or hypotheses should be included in the introduction part. I go back to the web page because there we can see also some examples. So if I go to the website, yes, you can see the website now. And if I click on the checklist, then in the right side, you see again that the items of the checklist, and the left side, you will have an explanation of the item and also an example of that. Maybe there is some problems with my internet connection because it takes times. It seems that it takes times to upload the web page. Maybe I should do it again. Okay, till that, it seems that there is some problems, but I can show you another checklist, which is CASP. This is CASP, and CASP is Critical Appraisal Skill Program. Here also we have some checklists, and one of them is you can click on the checklist. You can see the checklist here. For example, for CASP for randomized controlled trials, CASP for systematic review, CASP systematic review checklist, CASP qualitative studies checklist, cohort study checklist, and also in two formats of PDF and print and fill. So I just click on the PDF form. So can you see now the CAS checklist, CAS Critical Appraisal Skills Program?
Yes, yes, Professor Khan.
Yes. Okay, so here is 11 questions that have been designed to help you think about these aspects systematically. And there is an explanation how to use this appraisal tool. So you can study these explanations before going to the checklist itself. But I want to directly go to the checklist, and you can here see how it works. For example, it has 3 sections, as is mentioned here. 3 sections. Is the basic study design valid for a randomized controlled trial? Some items regarding to this question have been included in the section A. In the section B, we have some items that clarify, was the study methodologically sound or not? And in the section C, we will see what are the results. And in section D, it has 4 sections. In section D, will the results help locally or not? So we will go to the section 1. So the first question is that, did the study address a clearly focused research questions? And when you want to decide about this, you should consider, was the study designed to assess the outcomes of an intervention? Is the research question focused in terms of population, intervention, comparator chosen, and outcome measured? You can see PICO here. So it requires a randomized controlled trial also to have a PICO format for its aim, for its question. And you can choose yes, no, and can tell, and write anything you want here. The second question is, was the assignment of participants to the intervention randomized? And we should consider, how was randomization carried out? Was the method appropriate? As I told you, the method should be stated. Was randomization sufficient to eliminate systematic bias? And we should judge, we should evaluate this, we should consider this. Was the allocation sequence concealed from investigators and participants? So these are the questions that we should consider regarding the second item. Again, we can choose yes, no, or can tell. And then the third question is, were all participants who entered the study accounted for at its conclusion? We saw these items also in the previous checklist. They are not new, but just to know, these are the main items. Were losses to follow-up and exclusions after randomization accounted for? We should not have a significant dropout, and if we have some dropout, it should be justified. Were participants analyzed in the study groups to which they were randomized? Because this sometimes happens that some of, for example, patients or subjects in one of your groups, they because of any reason, they move to the other groups. And here, you can do intention to treat analysis or some other kinds of analysis. When you do intention to treat analysis, you just, irrespective of these subjects, you just continue to analyze the patients in the both groups. So you disregard this movement of some of the subjects to the other groups. So this is intention to treat. So if you exclude those if you exclude those in your those who have moved from your one of your groups to the other, and exclude those in your analysis, you exclude those, then it is per protocol, because this is another kind of analysis. This is just to know why this intention to treat means, because these in these analyses they are biostatistical aspects of randomized controlled trials, and I want just you to be familiar with these terms. And if you exclude those moving to your other group and treat them in the new group, then this is on treatment analysis. Because, okay, Just to know that. Here, intention to treat means that if some people from one of your groups have been moved to the other groups because of any reasons, if you do your analysis irrespective of this movement, then this is intention to treat analysis. Then was the study stopped early? If so, what was the reason? This is the other point that should be considered. Then we will go to the section B. In section B, we have where the participants blind regarding blinding to interventions they were given, where the investigators blind to the intervention they were giving to the participants, and where the people assessing or analyzing outcomes blind. Because as I told you, we have three kinds of blinding, and if we have all these three, then the study is triple blind. The fifth question is where the study groups similar at the start of the randomized controlled trial, and we should consider where the baseline characteristics of each study group, for example, age, sex, socioeconomic group, clearly set out. Were there any differences between the study groups that could affect the outcomes? The sixth question is apart from the experimental intervention, did each study group receive the same level of care? That is where they treated equally. As I told you, the two groups, for example, should be treated equally. And we should consider, was there a clearly defined study protocol? If any additional interventions were given, for example, tests or treatment, were they similar between the study groups? And were the follow-up intervals the same for each study group? This is end of the section B. And in section C, which is what are the results, then we are thinking about where the effects of interventions reported comprehensively. Was a power calculation undertaken? I think Dr. Shamshiri said something about power and its relation to sample size and so on. What outcomes were measured and were they clearly specified? How were the results expressed for binary outcomes? Were relative or absolute effects reported? Then were the results reported for each outcome in each study group at each follow-up interval? Okay. Was there any missing or incomplete data? Was there differential dropout between the study groups that could affect the results? And were potential sources of bias identified, as it was discussed in the previous presentation? Which statistical tests were used and were p-values reported or not? So this is a seventh question. And now in the question 8, was the precision of the estimate of the intervention or treatment effect reported? So the confidence intervals are really important to be reported, and the reader should be able to interpret the results according to the precision of the results, according to the confidence intervals that have been provided. So they should be provided. In scientific writing, we say that these confidence intervals and p-values should be also reported in the abstract. Do the benefits of the experimental intervention outweigh the harms and costs? This is also an important question. What was the size of the intervention or treatment effect? As Dr. Shamshiri had some examples of this. Were harms or unintended effects reported for each study group? Was a cost effectiveness analysis undertaken? So we know that cost effectiveness analysis allows a comparison to be made between different interventions used in the care of the same condition or problem. Okay. So we can consider if there is any like cost effectiveness analysis or not. And in section D, which is the last section, will the results help locally? Can the results be applied to your local population or in your context? Are the study participants similar to the people in your care? Would any difference between your population and the study participants alter the outcome reported in the study? Are the outcomes important to your population? Are there any outcomes you would have wanted information on that have not been studied or reported? So this means that is there any specific or specific aspects or a specific outcome that has not been considered? If there is, then it may show that there are some problems with the validity of the study. Are there any limitations of the study that would affect your decision. And the last question is, would the experimental intervention provide greater value to the people in your care than any of the existing interventions? So we should consider what resources are needed to introduce this intervention, taking into account time, finances, skills. Maybe there is a good intervention, but we don't have time, we don't have finance for that, we don't have money for that, we don't have some infrastructure for that, we don't have any skill for that. So we should forget about that. We cannot use it in our clinical practice. Are you able to disinvest resources in one or more existing interventions in order to be able to reinvest in the new intervention or not? Specifically when you are in a decision-making situation and you should make some decisions that discontinue a routine procedure and allocating the resources for a new technique or procedure. So these questions relate to that kind of decision making. And then you will have a summary here. Okay, this was CASP Critical Appraisal Program checklist for trial controlled trials. As you could see in the website, there were also checklists by CASP for other kinds of trials. I just want to see that if no, it seems that there is some question problems here regarding just I want to go back to the website to see if we could have now. Okay, let me just. Okay, let me just stop share and then try to see. Oh, it says still. I don't know what's the problem with the maybe my internet or maybe with the website of consort statement that we cannot see it. I try once more. Okay, I don't know what's the problem. It seems that's not possible to see the website, but you can go there. You can go there, and I just show you again the checklist in Word format, and you can go to the Consort website and you can see the examples. But as you can see here, there are many details here. So this 25 item checklist for reporting clinical trials. If you study this checklist, then you can have some also insight regarding critical appraisal of randomized controlled trials. So I leave it to you. You can just go to the website and see how does it work, what information should be included when you want to report a randomized controlled trial. Okay, so I think.
Professor Khamil, may I ask a question?
Yes, sure. I'm at the end of my presentation, so I'm ready to answer the questions if I can.
If somebody wants to do a RCT study, randomized control trial, does she or he should follow all the guidelines of this checklist in order that the when he or she does the study can be published? Do you recommend?
Yes, because now I think maybe all of the journals now, when you want to report randomized control trials, they do want you to report according to the concert checklist.
Yeah.
And also because randomized control trials should be registered somewhere. For example, we have in Iran, Iranian Center for Registry of Clinical Trials. There are some other in other countries. So before starting your clinical trial, you should register your protocol there. And it is available and visible for all who wants to see it. When you and at that point, you also are required to have these concert elements in your protocol. So when you have the concert elements there, then you certainly will be able to report your findings and to publish your articles according to that checklist. As I know, the prestigious journals, most of the journals now, they want you to report your article and findings and prepare your papers according to that concert checklist.
Okay, and if the RCT that you want to do has been repeated before, can we find it in order to not repeat a study again?
When you do your literature search, if there is any other RCT like or the same as the one you want to do, then you will find it. You will find it. But because there are many centers for registry, so it's not possible to, I think it's not possible to search through all of the registry of clinical trials. So the best way is to do a good literature review, good literature search, and then you will find if there is any previously done RCT with your topic or not.
Thank you. Thank you for your advice about this question that I had. Do the audiences have any questions? I think all of you, it takes a long time. It was difficult to hear and dissolve in our body all these informations. It was really difficult. In each sessions, it's highly recommended that again, after the session is finished and when you are not tired, again, review the informations to resolve it in your mind, the information that has been released to you. Is there any question? There is a question for critical appraisal or of RCT article. Consort is good or CASP is better? It is a question from you, Professor Khami. Which one do you recommend for RCT appraisal article?
We should notice that Consort is for reporting RCT and RCT. But the CAS checklist is for critically appraising. So there might be some differences. I told you that if you go through the Consort checklist, you will have a good insight to, then you will be able to better critically appraise RCTs. But I think that the CASP and checklist like that is more practical. A more practical checklist, and you can practically use them. As you could see, for example, in the CASP checklist, there were some spaces, and you could even write some notes, and then according to all of this information, then you can decide if to accept the results or not.
Yeah. By this way, Consort is for critical appraisal of an article, but CASP is a checklist to know what details we should follow.
Sorry, I could not. What did you say?
CASP is a checklist to follow the details and items for an RCT, but Consort is different. It's not a checklist. It's for the critical appraisal of an articles or the information that we have.
Vice versa. In fact, the concert checklist is more in detail. It has many details. But the CAS checklist just 11 questions.
Easier, it's most user friendly.
Yes.
Apparently, there is no other questions. So, do the audience let us to leave the program for today? Okay, apparently there is no questions. I wish you a nice. It depends on the time and which country you are. Wish you a good night. Wish you a good day. Wish you a good evening. Every country that you are. Best wishes for you. I wish all of you are in complete health and safety during this COVID-19 pandemic condition. Take care. I hope we can see you again for the three more sessions we have. 2 more sessions we have.
Two more
Waiting
sessions.
for you for, pardon?
2 more sessions.
Two more sessions. I hope we can see you for the next Wednesday and wish you the best. Have a nice time. Take care and bye-bye, everybody.
Thank you for your coordination. It was really helpful. And then in the next session, we will go again deeply through these both the randomized control trials and also systematic reviews. So stay with us for the next session and next presentations was to our international speakers. And okay, I just want to say goodbye to all, but I think the final photo, we should have it now. So if it's possible for everyone, it's possible to.
Yeah, I want a final photo with a mask. It could be a memory of during the pandemic condition with the mask.
Okay. So just waiting for those who can open their camera.
So from different countries, now I can see your faces. I wish all the guys the best in complete health and safety. It's fine to see the face of the participant. It's great. Hello, Dr. Shahrez Samad. I have not seen you for a long time. Dr. Azadeh Fartash and all the other audience and guys from different countries. Now we are in a friendly virtual program. I wish and I hope to see you, not virtually, in reality, in our country, in our home country, in Tehran University. I hope in the near future, after pandemic condition resolve, we can settle down program that you kindly participate in this program. We can see you face by face. Wish the best and for good future. Was the photo taken or can we leave?
Yes, I take a lot of photos.
Really, a lot of photos. So one of them will be placed in the website and you can see it. Best wishes for all, guys. Bye for now.
Thank you. Bye.
Bye, Professor Khami. Bye, Professor Shamshiri and all guys.